During the most devastating phase of the pandemic's first wave, long-term care homes in this province were in such dire straits they required the assistance of the Canadian military. Their efforts on the home front were critically important to caring for residents. Their subsequent report on what they found in those homes shone a light on some devastating conditions. With us for a broader view of what was involved, we welcome, in the provincial capital, in Upper Forest Hill Village, Lieutenant Colonel James Stocker of the Canadian Armed Forces, who was commanding officer of Territorial Battle Group 1 when it was sent in to assist. And in Hamilton, Ontario, there's Corporal Leila Ahmed, Canadian Armed Forces medical assistant and a registered nurse deployed in the effort. And we're delighted to have you two with us on this important day on our calendar. I just want to start by, let's take everybody back. And I want to remind everybody about what Operation Laser was all about. It was the Canadian Armed Forces' plan to rapidly respond to the pandemic, in this case, COVID-19. And let's bring this graphic up and we can tell everybody what went on. In April 2020, the Government of Ontario asked the Government of Canada to send Canadian Armed Forces in to assist in long-term care facilities. From the 28th of April to the 3rd of July, 500 soldiers were deployed to 7 long-term care homes in the Greater Toronto Area. Groups included both regular forces and reservists from the Army, Navy, and Air Force, and approximately 50 soldiers per facility were brought to bear. Lieutenant Colonel Stocker, let me start with you. Did the soldiers know what their mission was before they were actually deployed?
A quick answer, Steve, no. So in the initial phases of the COVID pandemic, a decision was made to form a rapid response versatile unit, which was capable of responding to a range of emergencies that the province of Ontario may have need of us. And we formed a unit known as Territorial Battle Group 1, which was a composite unit, and deployed that unit in segregation to Borden to be prepared to respond again to a wide range of emergencies. Now, this could have been a COVID type emergency. It could have been a flood or a forest fire. And so we trained for a wide range of contingencies. And at the end of the day, of course, the ultimate task selected in response to a request for assistance from the province was a task to provide that emergency support to those select long-term care facilities in the GTA.
If they didn't know what they were being sent off to do, what did they think they were being sent off to do?
The Territorial Battle Group 1 mission was one of readiness and to be ready to respond to a range of contingencies. And like I said, likely tasks included floods or forest fires in communities which would have already been stressed by COVID. And these communities have fairly small emergency management departments, and they might have been quickly overwhelmed in light of COVID. And so we prepared for a wide range of contingencies. Again, northern evacuations, floods, forest fires, or more of a COVID type response. And ultimately, of course, the COVID response was what ended up coming to pass.
Mm-hmm. And one more follow-up, if I could. Is it fair to say that when people join the Canadian Forces, doing this kind of work in a long-term care home is probably not at the top of what they think the list of things is that they might be asked to do?
I think that's fair to say. It certainly wasn't anything that I anticipated. I don't think it was anything any of the soldiers anticipated. COVID is an unpredictable pandemic, an unpredictable emergency. But what we do train for in the CAF is readiness and general problem solving, and the ability to apply that general problem solving skill set when you plug in the right specialist advice. So even though it's an unfamiliar task for certainly the generalists who worked as general duties personnel, and in fact, I would offer probably a little bit unfamiliar even for our medical personnel who train more for things like trauma, field hospitals, base hospitals and base clinics, we do train that level of responsiveness, that ability to respond to the unforeseen, provided we get the right expert advice. And that really was what we did in TBG1 in the long-term care facilities.
Okay. Corporal Ahmed, when you were brought onto the scene, what were your expectations as to what you thought you would find?
So I'll say it's very similar to Lieutenant Colonel Stocker. We didn't really know at the beginning what we were to do. At the time, I was working both mental health nursing and emergency room nursing. So I was already sort of responding on the COVID-19 front line, if you want to call it that. As they started to sort of look for who would be available to go to Op Laser, again, details were still sort of fuzzy. We were ready for whatever was needed. But that being said, the details had not been hashed out at that point. So we were very, very quick moving. The timeline was very, very short because we wanted to get into the homes and respond as soon as possible and do what was best for the residents and as well to aid the staff and sort of help to stabilize that situation.
And we should just say right now, because the background does not really give away where you are, but you're at work right now. You're at a hospital in Hamilton, you're on a break, And we are really grateful that you're taking your break to be with us here. We won't take too much of your time so that we can let you get back to the important work that you do. Having said all of that, during your collective time in these long-term care homes, the military did its work and then wrote a report. And we want to share some of the details of that report. I well remember Premier Doug Ford going to the podium at a press conference and saying this was one of the hardest things that he ever read, one of the hardest reports he ever read. Here we go. You folks saw aggressive behavior from staff towards residents that the military deemed to be abusive, including degrading or inappropriate comments, and refusing to stop or slow down when patients complained of pain. Your soldiers saw medication that had been expired for months. You saw insect infestations, including cockroaches and ants in these long-term care homes, forceful feeding that caused audible choking of patients, extremely severe bed sores, including some that had worn through to the bone, patients with soiled diapers who were left in their beds. In certain cases, military personnel had to bring their own food to ensure residents were fed, and no accountability for staff who failed to uphold basic care needs. Corporal, I want to go back to you. I get that there's an independent investigation into all of this going on right now, so you are somewhat hamstrung from what you can say. But having said that, what was the state of the long-term care homes that you found yourself in when you were brought in for this mission?
Sure. So I will say that every home was different. Every home had unique challenges. So there was different reasons that those homes were on outbreak. Our goal in mind was to help stabilize that home. So it really was our responsibility not to go in and sort of judge and be punitive, but to sort of support the home. And you would see sort of across the board that there were some staff that had been working for almost a month straight with no breaks, 8 or 12-hour shifts. There was sometimes a lack of sort of infection prevention and control policies that were being implemented, or they were so short-staffed that they really weren't able to. So a lot of it was education, a lot of it was assessment, but obviously we have an obligation to care for people ethically and safely wherever we go and to report up those findings. So while I can't really talk about the specifics of the report, I can say that it is our obligation to care for people and to ensure that a high standard of care is being maintained, and that even once we're gone, that there are policies in place and that the education is in place to make sure that that high standard can maintain.
Fair to say you didn't see much of a high standard at work there?
I would say that you could see there's obviously issues, right? We know that issues in long-term care aren't necessarily new. I would also say that there were staff that literally had risked their lives being there, civilian staff. And so it wouldn't be fair to paint it with one brush to say that no one cared about the residents or that all residents were treated poorly. What issues of concern were brought up and reported as such, but there were also staff there that did quite an excellent job of caring for people and have worked there for a number of years.
Lieutenant Colonel Stalker, I really want people to be reminded of the kind of work that your people had to do, the kinds of equipment they had to wear, the kind of shifts they had to work, the kind of things that they encountered. Could you fill in some of those blanks for us?
Yeah, absolutely. It's a great question. So Territorial Battle Group 1 was formed towards the beginning of April. And from the very beginning, we took a pretty strict stance towards potential COVID-19 infection. So pretty detailed segregation, podding. So if you worked within a certain team, you stayed within that team for the nature of the deployment. Once we pushed down into the long-term care facilities, as you mentioned, towards the end of April, we really broke down into what were called augmented civilian care teams. This is about 50 people per team and one team, roughly speaking, per facility, although there was some room to take into account specific considerations. And each of these teams was broken down into a mix of both medical professionals, nurses, and medical technicians, as well as generalists, we call general duties personnel. And these were general soldiers, sailors, or aviators who opted to take part in this mission. And again, this was a volunteer mission, in particular for the reservists who took part. The medical personnel did things that you'd expect medical personnel to do in terms of direct patient care, whereas the generalists did things like food portering, cleaning, various preparations, logistical help, anything we could do to assist the facility in overcoming this emergency. And in support of them, we had a number of people who worked outside the home, taking care of those who were inside the facility in terms of things like preparing their meals, doing their laundry, and assisting with their accommodations. And this was all part of a broader Ontario, broader pan-governmental response to the crisis.
We should remind everybody, your people were sent in at a time when there was a great deal, a lot less was known about COVID and a lot more fear was in the air. So I'm wondering whether any of your people declined the assignment.
Not a one. We did not have a single individual decline the assignment. You're quite correct. The level of knowledge about COVID was far less now, or was far less then than there is now. There was understandable concern and to a degree a little bit of fear, not only for themselves but also for their families. But not a one declined the opportunity to serve.
And Corporal Ahmed, what kind of personal protective equipment did you manage to get in order to do your work?
Sure. So around the time that we were in the homes, we determined that for the most part, unless there's an aerosolizing generating procedure, that we weren't to be wearing N95s, that droplet masks were to be okay. So we were fit at all times with a mask, with a face shield, with a gown and gloves. Obviously, wearing that equipment and not using it properly also is a huge issue. So a lot of the education that we would do, especially with civilian staff, was to say, okay, this is how you don it or put it on properly, and this is how you doff it. Because as you're taking on and taking off personal protective equipment, that is sort of your greatest area of risk. You kind of get used to it, but you don't really get used to it even after a series of weeks. But it is something now that is both civilian and military. We are using personal protective equipment to protect ourselves and to protect our residents and patients as well.
You can be really candid with me after the fact here, because obviously you got through it, but did you worry at some point that you were going to get this disease and die?
I think like any healthcare provider and really like any citizen, there is always that concern of worry. But we are given the training, and I've been a nurse for a number of years. I've been an RPN for a number of years. So you're given the training, you understand the risks, and you're outfitted with the proper PPE. So you have the supports in that section. It doesn't mean that you still cannot contract the virus. It still is a potential. But we're human beings, right? You're going to worry about your family while you're away. But at the end of the day, there's a mission to complete and there's people that need help. So we take the necessary precautions. We use our PPE, we wash our hands, we try not to touch our face. It doesn't guarantee that we're not going to get sick, but it gives us a much better chance of coming out healthy.
I mean, I asked the question because I presume you saw a good share of death in those homes. Is that right?
We know that our geriatric population generally tends to be the most susceptible sort of to the side effects and unfortunately has a higher mortality rate for COVID-19. Part of nursing, yes, is caring for our dying and doing so in a compassionate way. So we did have the opportunity, obviously, to help people sort of through the end of their lives in a comfortable and compassionate way. And that's not something that's necessarily unusual for long-term care homes. Oftentimes, it's that person's last home. But we wanted to make sure that whether it was related to COVID-19 or old age or whatever the situation was, they were treated with dignity and respect.
Well, yeah. Again, I'm going to push this one more, if you don't mind, because I do remember many families at this time were expressing just incredible sadness about the fact that their relatives, and I'm not talking about the homes that necessarily you were involved with, but all around Ontario, their relatives were dying and they weren't able to get into their homes to visit their relatives, and their relatives died alone. And that was tragic. So I'm again going to infer that there were moments that you experienced where you may have held somebody's hand as they died and you were the last person they saw. Is that right?
That is correct, although we would try and involve the families in any way that was possible. So although the risk at that time was too great to allow them into the homes, we would have either phone calls or FaceTime videos. Is it a complete replacement for in-person visits? I don't think so, but we were doing the best we could with the availability that we had and sort of with the safety precautions in place. It definitely is not my first time sort of helping people to the other side and ensuring that they have a dignified death. But it was especially important for us because of the lack of family that we were there to support people sort of no matter what the situation was.
Lieutenant Colonel, I should ask you, did any of your people contract COVID-19?
Yes, Steve, we did have some contraction of COVID-19, and those numbers were released by the government to the media. I am gratified to note the number was quite low, and that everyone ended up healthy in the end. And again, keeping in mind that these soldiers, sailors, aviators, medical professionals, and generalists were working in a higher risk environment, there was some contraction, but at the end of the day, everyone was healthy.
Good to know. Now, for the longest time, of course, during this period, these isolated soldiers and seniors essentially were the only point of human contact that they had in the world. It was with each other. Was there any particular exchange that stood out for you that you can recall and tell us about tonight?
There were a couple of really touching moments, and I've related to other folks. We did have one soldier who took to playing piano in one of the long-term care facilities in his limited time after hours, and you could really feel the mood lift when he did so. That sort of that art touching people. We also had a number of our personnel helping residents build bird feeders to hang outside their windows. And Corporal Ahmed quite aptly noted that isolation was a problem for some of these residents, as it would be for all of us. So the idea of having a regular winged friend come visit you every day, I mean, it sounds like a small thing, but having that regular contact pays huge dividends for mental health. And we noticed an immediate uptick in those cases. So that countless examples of our people adding that touch of humanity, going out of their way to make people's lives a little bit better. I'm incredibly gratified to relate those stories.
Corporal Ahmed, I want to ask you, how do I put this? Don't take this the wrong way, but you are, in all of the answers that you've given us here tonight, you are really name, rank, and serial number. Like, you're really doing it by the book, and I'm impressed with your professionalism and how you appear to be very unemotionally affected by what you had to do and what you saw. And of course, that's what we want in a soldier. We don't want somebody breaking down when there's a job to be done. But I do need to ask whether, when the day is over and when you go home and when the head hits the pillow, whether this has an impact on you.
I would definitely say I'm probably the opposite of unemotionally affected. I tend to put a lot of my heart into nursing and into caring for people. I see a time and a place, obviously, to be able to sort of have that moment to decompress, but the empathy is always there. There are certain residents and certain patients that just hit you harder and that you will always sort of carry on with you. And I haven't forgotten any of them months down the line. And they've also changed the way, now that I've returned to civilian nursing, they've changed the way that I interact with people, of just taking a little bit more extra time to listen to them, to be kind to them, to sort of hear out their concerns. And then as well, sort of introspectively looking at myself and what can I do to sort of make these people's lives better, whether they're 2 days old or whether they're 90 years old. So it definitely has changed me as a person, and it's changed me as a nurse. But it's, at the end of the day, I would say most soldiers, I think, are maybe outwardly what we would say cold, but inwardly are extremely empathetic. And you need to have that to be able to be a soldier. You need to be kind.
Now, James Docker, you served in Kandahar, Afghanistan, which is the kind of mission that I suspect people watching this would expect that a member of the Canadian Forces would undertake. Would you be able to compare that kind of more traditional mission with this mission that you undertook on behalf of seniors in the province?
I think it's a little bit incomparable. Every mission is unique. This mission is perhaps more unique than most, if I can say that. But one thing that these missions all have in common is they relate to the idea of service and putting yourself out there in service to Canada and Canadians. This is, an immediate example of that. And so while this mission, missions in the Middle East, missions in Africa, missions all over the world where Canadian forces, soldiers, sailors, and aviators serve, they all relate to that concept of service. And I think that's what motivates people in uniform.
I would also assume that there were members of these residents of these long-term care homes who were veterans, right? Who served back in the day, maybe 40, 50, 60 years ago, maybe more. And I wonder if your soldiers had interactions with them, and if you have any stories about those interactions, if they took place, that you could share with us.
Certainly. And I think, and quite right, we did encounter folks who are veterans who served perhaps in the Second War or Korean War. And I think what it served to do was reduce a sense of the othering. And especially if you consider some of the soldiers and folks who worked in these homes in the general duties team quite young. And so there's a real sort of separation between them and the residents. And to recognize that there are veterans in these homes, it sort of serves to reinforce the fact that this isn't some distant other. This is us in 30, 40, 50 years. And it was quite extraordinary, in fact, when some of the soldiers found that some of the residents were from the very same regiments they were serving in. So a real sense of bonding took place at that point.
That must be quite a connection.
Very much so.
And I don't know how this works. I know some soldiers don't want to talk about their service, and others are all too happy to tell you about what they did and where and when and so on. Did you have some of those kinds of interactions?
There were quite intimate personal connections made between the sailors, and aviators, whether they be general duties or whether they be medical personnel, and the residents in the homes, and no doubt a lot of stories being swapped about experiences both overseas and domestic.
Corporal Ahmed, to your knowledge, did you have any vets that you had to care for?
We actually had quite a few on the floor that we were on. It was quite interesting to see their faces light up as soon as, because we were wearing scrubs at the time. I think it's important to note. So we were not in combat. So we weren't immediately identifiable along with our gowns and all of our other PPE. They didn't necessarily know where all of these new staff came from. They just knew that there was new staff. Obviously, respecting patient confidentiality, we did have one gentleman who was in his late 90s who was an Air Force veteran. And it was just as simple as, if we were done the tasks at the moment, one of us would go sit with him and he could tell stories for hours and hours and hours. And at times we would talk to his daughter and she would say, you know what, I've never seen him so happy and so alert. It's nice to know that even though he's alone, he's not lonely. So it definitely is a bond sort of that transcends generations, and that I'm glad we were able to sort of support them in their final years, but also understand to some degree what they went through in their early years of their lives.
So late 90s, he must have been a World War II vet?
He had gone to, yes, he was World War II.
World War II. Okay, I appreciate you're trying not to offer too much identifying information to respect their privacy, and I appreciate that. But I am imagining the joy that they must have sensed once they realized that you too were Canadian Forces, and that bond that must have been created. What was that like?
It definitely is a very, very special bond. And it's something where when we were departing from the home, so once the home had been stabilized, there was a lot of tears shed on both sides because you'd built that friendship, you'd built that mutual understanding, and you'd just spend hours and hours and hours talking and conversing. And you could have the same conversation 10 times and it would still make them very, very happy. So it definitely is something that I hope, if I ever get to that age, that I have someone caring for me and I can make that bond as well.
I'm not going to pretend that this final question for each of you is all that original, but it seems like the right question to ask on Remembrance Day, and that is, Lieutenant Colonel, why don't you start us off? What do you think about on this Remembrance Day?
I think about those who came before me, who served and sacrificed, and how to do in the small way that I can, how best to honor their memory.
And Corporal Ahmed, how about you? What do you think of on Remembrance Day?
Absolutely. So I think of the sacrifices that were made for generations before, whether it's the geriatrics that we were caring for, or if it was, for example, tours like Afghanistan. But I also like to think forward about the future sort of missions that will go on. And we know already that they're not predictable at this point. And I hope that we continue to support Canadian citizens, whether it's on Canadian soil or elsewhere, and that we continue to support Canadian soldiers with mental health and peer support sort of efforts to ensure that no one feels alone, and that we're able to continue on and complete our missions, but also take care of each other and as well as Canada.
Well, I can only imagine how grateful the families that you helped feel on this Remembrance Day, and we're grateful that the two of you could spare some time for our viewers on TVO to let them know about the work that you have done. Lieutenant Colonel James Stalker, Corporal Layla Ahmed, thank you both so much.
Thanks very much indeed.
Thank you.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.